For decades, we've been told that managing blood pressure becomes even more critical as we age, and that medication is the safest, most effective path to cardiovascular health. But what if I told you that some of the most commonly prescribed blood pressure medications might actually be shortening your lifespan after 60? Today, I'm going to share with you the hidden medical truth about 5 blood pressure drugs that could be doing more harm than good in senior bodies, and why the approach to hypertension treatment needs to fundamentally change as we age. I'm not here as your doctor, but as someone who's spent years researching the intersection of aging, medication, and optimal health. What I've discovered will challenge everything you thought you knew about blood pressure management in your golden years. The pharmaceutical industry has created a one-size-fits-all approach to hypertension that completely ignores the unique physiology of aging bodies. Today, we're going to expose this dangerous oversight and give you the knowledge you need to make informed decisions about your cardiovascular health. The problem with blood pressure medication in seniors isn't just about side effects or interactions, though those are certainly concerning. It's about a fundamental misunderstanding of what constitutes healthy blood pressure as we age. The medical establishment continues to apply the same blood pressure targets to 80-year-olds as they do to 40-year-olds, despite mounting evidence that this approach is not only ineffective, but potentially lethal. When we artificially lower blood pressure too aggressively in older adults, we're essentially starving the brain and vital organs of the blood flow they desperately need to function properly. Consider this startling reality. Every year, thousands of seniors suffer from falls, cognitive decline, and organ damage, not because their blood pressure was too high, but because it was lowered too dramatically by well-meaning physicians following outdated guidelines. The aging cardiovascular system requires higher pressure to pump blood through increasingly stiff arteries to organs that need adequate perfusion to maintain function. Yet we continue to chase numbers on a blood pressure cuff, rather than focusing on the overall health and functionality of the person attached to that arm. The first medication that's causing widespread harm in seniors is ACE inhibitors, particularly when prescribed at standard doses without consideration for age-related kidney function decline. These medications work by blocking the production of angiotensin-converting enzyme, which normally helps regulate blood pressure by constricting blood vessels. While this mechanism sounds logical in theory, the reality for aging bodies is far more complex. As we age, our kidneys naturally lose function, processing medications more slowly and less efficiently. When ACE inhibitors accumulate in the system due to reduced kidney clearance, they can cause dangerously low blood pressure episodes that lead to falls, hip fractures, and emergency room visits. The most insidious aspect of ACE inhibitor toxicity in seniors is that it develops gradually. You might notice increasing dizziness when standing, unexplained fatigue, or mild confusion. But these symptoms are often dismissed as normal aging rather than recognized as medication side effects. Meanwhile, your blood pressure readings look perfect on paper, giving both you and your doctor false reassurance, while your quality of life steadily deteriorates. The persistent dry cough that affects up to 20% of people taking ACE inhibitors becomes even more problematic for seniors, as it can lead to sleep disruption, social isolation, and in some cases, aspiration pneumonia. Recent studies have shown that seniors taking ACE inhibitors have significantly higher rates of cognitive decline compared to those managing their blood pressure through other means. This occurs because these medications can reduce blood flow to the brain just enough to impair cognitive function over time, but not dramatically enough to cause an obvious stroke. The brain becomes chronically undernourished, leading to what researchers are now calling medication-induced cognitive impairment. The tragedy is that many of these cognitive changes are irreversible, even after discontinuing the medication. The second category of blood pressure medications causing significant harm in seniors is calcium channel blockers, particularly the immediate-release formulations. These drugs work by preventing calcium from entering the muscle cells of blood vessels and the heart, causing blood vessels to relax and the heart to beat with less force. While this mechanism effectively lowers blood pressure, it creates a cascade of problems specifically in aging cardiovascular systems. The most immediate concern is the dramatic drop in blood pressure that can occur when seniors stand up quickly, a condition called orthostatic hypotension. Orthostatic hypotension from calcium channel blockers isn't just about feeling dizzy for a few seconds. In seniors, this condition significantly increases the risk of falls, which are the leading cause of injury-related death in people over 65. When blood pressure drops suddenly upon standing, the brain doesn't receive adequate oxygen, causing not just dizziness, but also confusion, weakness, and loss of coordination. These episodes often occur in bathrooms, where seniors are most vulnerable, leading to devastating hip fractures and head injuries that can permanently alter their independence and quality of life. Beyond the fall risk, calcium channel blockers can cause a condition called peripheral edema, where fluid accumulates in the legs, ankles, and feet. While this might seem like a minor inconvenience, the swelling significantly increases the risk of skin breakdown, infections, and blood clots in seniors whose circulation is already compromised by aging. The additional fluid retention also strains the heart, potentially worsening the very cardiovascular problems these medications are supposed to prevent. Many seniors find themselves prescribed additional medications to manage the fluid retention, creating a dangerous cycle of pharmaceutical interventions. The cardiovascular system of a 70 or 80-year-old operates under different rules than that of younger adults. Calcium channel blockers can over-relax blood vessels to the point where adequate pressure isn't maintained to perfuse vital organs, particularly the kidneys and brain. This chronic underperfusion can lead to gradual kidney function decline and subtle cognitive impairment that develops so slowly it's attributed to normal aging rather than recognized as a medication effect. The irony is profound. Medications prescribed to protect cardiovascular health can actually accelerate cardiovascular aging when used inappropriately in seniors. The third problematic category involves thiazide and thiazide-like diuretics, which have been considered first-line treatment for hypertension in older adults for decades. These medications work by increasing the elimination of sodium and water through the kidneys, reducing blood volume and therefore blood pressure. However, this seemingly straightforward mechanism becomes problematic in aging bodies that are already dealing with reduced kidney function, altered hormone levels, and decreased ability to maintain proper fluid balance. The most dangerous aspect of diuretic use in seniors is the rapid and often unpredictable loss of electrolytes, particularly potassium, sodium, and magnesium. While younger bodies can quickly compensate for these losses, aging kidneys struggle to maintain proper electrolyte balance even under normal circumstances. When diuretics are added to the equation, the risk of dangerous electrolyte imbalances skyrockets. Low potassium levels can cause dangerous heart rhythm abnormalities, muscle weakness, and cognitive impairment. Low sodium levels, a condition called hyponatremia, can cause confusion, seizures, and coma in severe cases. Perhaps most concerning is the way diuretics can trigger a condition called volume depletion syndrome in seniors. This occurs when the body loses too much fluid too quickly, leading to kidney dysfunction, confusion, and cardiovascular collapse. Unlike younger adults who might simply feel thirsty and drink more water, seniors often have diminished thirst sensation and may not recognize the early warning signs of dehydration. By the time symptoms become obvious, significant organ damage may have already occurred. The dehydrating effects of diuretics also dramatically increase the risk of urinary tract infections in senior women, as concentrated urine provides an ideal environment for bacterial growth. These infections frequently progress to more serious kidney infections or bloodstream infections in older adults, whose immune systems are less capable of fighting off bacterial invaders. The cycle becomes self-perpetuating. UT is cause confusion and falls, leading to hospitalizations where more medications are prescribed, further compromising the immune system and kidney function. Beta blockers represent the fourth category of blood pressure medications that can cause significant harm when used inappropriately in seniors. These drugs work by blocking the effects of adrenaline on the heart and blood vessels, causing the heart to beat more slowly and with less force. While this can effectively lower blood pressure, it also removes many of the cardiovascular system's natural adaptive mechanisms that become increasingly important as we age. The aging heart relies heavily on its ability to increase heart rate and contractility in response to physical and emotional stress. When beta blockers blunt these responses, seniors lose a crucial safety mechanism. Simple activities like climbing stairs, getting out of a chair, or even having an emotional conversation can become physically overwhelming because the heart cannot respond appropriately to increased demands. This leads to exercise intolerance, social withdrawal, and a gradual decline in physical conditioning that accelerates the aging process. Beta blockers can also mask important warning signs of other medical conditions in seniors. For example, an infection that would normally cause an elevated heart rate might go unnoticed because the beta blocker prevents the heart rate from rising appropriately. This delayed recognition of serious medical problems can lead to life-threatening complications, particularly in seniors who may not develop typical symptoms of illness. The medication essentially removes one of the body's most important alarm systems at a time when early recognition of health problems becomes increasingly critical. The cognitive effects of beta blockers in seniors are particularly troubling. These medications can cross into the brain and interfere with neurotransmitter function, leading to depression, memory problems, and what many describe as mental fog. Unlike younger adults who might experience these effects mildly and temporarily, seniors often develop persistent cognitive impairment that significantly impacts their ability to live independently. The depression associated with beta blocker use in older adults can be severe enough to increase suicide risk, yet it's often attributed to aging or other medical conditions rather than recognized as a medication side effect. The fifth, and perhaps most concerning category, involves combination blood pressure medications that contain multiple active ingredients in a single pill. These medications are often marketed as convenient solutions that improve compliance by reducing the number of pills seniors need to take daily. However, the fixed-dose combinations create unique risks in aging populations whose medication needs may change rapidly due to illness, dehydration, or changes in kidney function. When seniors experience any medical stress, from a simple cold to major surgery, their blood pressure medication needs often change dramatically. With single-ingredient medications, doctors can adjust individual components as needed. However, combination pills offer no such flexibility. If a senior becomes dehydrated during an illness and needs less diuretic effect, the entire combination must be stopped or continued at inappropriate doses. This all-or-nothing approach frequently leads to dangerous blood pressure swings that can cause strokes, heart attacks, or kidney failure. The masking effect of combination medications also prevents both patients and doctors from understanding which specific component might be causing side effects. When a senior experiences dizziness, cognitive impairment, or falls while taking a combination blood pressure pill, it becomes nearly impossible to identify whether the problem stems from the ACE inhibitor, the calcium channel blocker, the diuretic, or the interaction between all three. This diagnostic confusion often leads to the prescription of additional medications to treat what are actually side effects from the original combination drug. Perhaps most tragically, combination blood pressure medications often continue to be prescribed even when they're clearly inappropriate for a senior's current health status. A 90-year-old with multiple medical conditions and limited life expectancy might still be taking the same aggressive combination blood pressure medication that was prescribed when they were 70 and relatively healthy. The medication that once provided benefit now increases their risk of falls, cognitive decline, and poor quality of life. But the fixed-dose combination makes it difficult to make appropriate adjustments. The hidden medical truth about blood pressure management in seniors extends far beyond these 5 specific medication categories. It encompasses a fundamental misunderstanding of what healthy aging looks like and an over-reliance on treating numbers rather than people. The medical establishment has created guidelines based primarily on research conducted in younger, healthier populations and applied them universally without considering the unique needs and risks of aging bodies. Consider Maria, a vibrant 78-year-old who came to my attention after a series of unexplained falls. Her blood pressure readings were perfect according to current guidelines, maintained by a combination of an ACE inhibitor and a thiazide diuretic. However, her quality of life had deteriorated dramatically over the previous year. She'd stopped gardening because she felt too weak and dizzy, avoided social activities because of confusion and fatigue, and lived in constant fear of falling again. Her family attributed these changes to aging, and her doctor was pleased with her blood pressure control. It wasn't until we recognized that her medications were causing chronic dehydration, electrolyte imbalances, and oversuppression of her cardiovascular system that we could begin to restore her vitality. After carefully reducing and eventually eliminating her blood pressure medications under medical supervision, while focusing on lifestyle modifications and addressing her individual risk factors, Maria regained her energy, mental clarity, and confidence. Her blood pressure readings were slightly higher than the guidelines recommend, but she was able to return to her beloved gardening, re-engage with her community, and most importantly, live without the constant fear of falling. This transformation illustrates the critical difference between treating blood pressure numbers and treating the whole person. The research supporting a more conservative approach to blood pressure management in seniors continues to accumulate. The landmark SPRINT Senior study found that aggressive blood pressure lowering in adults over 75 actually increased the risk of serious adverse events, including kidney dysfunction, dangerously low blood pressure episodes, and falls resulting in injury. Similar studies have consistently shown that the blood pressure targets appropriate for younger adults can be harmful when applied to seniors, particularly those with multiple health conditions or limited life expectancy. What makes this situation particularly tragic is that many of the health problems attributed to aging are actually consequences of over-medication. The weakness, confusion, falls, and social withdrawal that we've come to accept as inevitable parts of aging are often preventable and reversible when we address inappropriate medication use. Seniors and their families struggle with the emotional and financial burden of declining health, not realizing that the very medications prescribed to help them might be the primary cause of their suffering. The path forward requires a complete paradigm shift in how we approach blood pressure management in older adults. Instead of reflexively reaching for medications to achieve arbitrary numbers, we need to focus on optimizing overall health, functionality, and quality of life. This means considering each senior as an individual with unique needs, risks, and preferences, rather than applying one-size-fits-all treatment algorithms designed for younger populations. For seniors currently taking blood pressure medications, the solution isn't to immediately stop all treatment, which could be equally dangerous. Instead, it requires working with knowledgeable healthcare providers who understand the complexities of aging physiology and are willing to prioritize quality of life over guideline adherence. This might involve slowly reducing medication doses while monitoring for any negative effects, switching to gentler alternatives, or in some cases, accepting higher blood pressure readings in exchange for better overall functioning and well-being. The lifestyle interventions that can safely and effectively manage blood pressure in seniors are often more powerful than medications, without any of the dangerous side effects. Regular gentle exercise, such as walking or swimming, can improve cardiovascular health while maintaining muscle mass and bone density. Stress reduction techniques like meditation, deep breathing, or gentle yoga can lower blood pressure while improving mental health and sleep quality. Dietary modifications that reduce sodium intake while ensuring adequate nutrition can provide blood pressure benefits while supporting overall health. The emerging field of precision medicine offers hope for more individualized approaches to blood pressure management in seniors. Rather than applying population-based guidelines to everyone, precision medicine considers genetic factors, kidney function, other medical conditions, medication interactions, and personal preferences to develop truly personalized treatment plans. This approach recognizes that the optimal blood pressure for a healthy 65-year-old might be completely inappropriate for an 80-year-old with multiple medical conditions. The medical community is slowly beginning to recognize these issues, with newer guidelines acknowledging that blood pressure targets should be less aggressive in older adults, particularly those with limited life expectancy or multiple medical conditions. However, change in medical practice occurs slowly, and many healthcare providers continue to follow outdated protocols that prioritize achieving specific blood pressure numbers regardless of the consequences for the individual patient. As we age, the goal of medical treatment should shift from disease prevention to quality of life optimization. For a senior with limited life expectancy, preventing a heart attack that might occur in 10 years makes little sense if the medications used for prevention cause immediate suffering through falls, cognitive impairment, and loss of independence. This doesn't mean abandoning medical care, but rather refocusing it on what truly matters, maintaining function, dignity, and joy in the years that remain. The hidden medical truth about blood pressure drugs in seniors is that less is often more. The medications that serve younger adults well can become toxic burdens for aging bodies that process drugs differently, respond to treatments differently, and have different health priorities. Recognition of this truth opens the door to more compassionate, individualized care that honors the wisdom and preferences of seniors, while providing genuine health benefits rather than simply treating numbers on a chart. The transformation possible when we align medical treatment with the realities of aging is profound. Seniors who have lived for months or years in a fog of medication side effects can experience renewed clarity, energy, and engagement with life. The fear of falling can be replaced by confidence and movement. The social isolation caused by medication-induced weakness and confusion can give way to meaningful connections and activities. These aren't just improvements in health metrics, but genuine enhancements to the human experience that make the golden years truly golden. The 5 blood pressure medications we've discussed today represent just the beginning of a larger conversation about appropriate medical care for aging populations. The principles of individualized treatment, quality of life focus, and recognition of aging physiology apply to virtually every aspect of senior healthcare. When we embrace these principles, we create the possibility for aging that is not just longer, but richer, more meaningful, and genuinely healthy. Your blood pressure numbers are not more important than your ability to garden, play with grandchildren, travel, or simply feel alert and energetic throughout your day. The hidden medical truth is that protecting these precious aspects of life often requires questioning conventional medical wisdom and advocating for approaches that honor both the complexity of aging bodies and the value of lived experience. The journey toward optimal health in your senior years begins with understanding that you deserve medical care that enhances your life, rather than merely extending it while diminishing its quality. 7 blood tests your doctor orders, but you don't need after 65. Dr. Evelyn Hart explains.